Hi everyone, I am Dr. Prashant. I am a pediatric neurologist working at Hyderabad. Now today we will see a very common topic, cerebral palsy, in detail. Now there are so many misconceptions or misguiding to the especially parents that cerebral palsy we cannot do anything, but that is not true. So let us see first what is mean by cerebral palsy. Cerebral palsy, in short, suppose your child is unable to walk, unable to crawl, or like neck holding, sitting, walking, standing, and running. It's coming late. In general, if it's not on time, in general we'll call it as a cerebral palsy. Sometimes we'll call it as a static encephalopathy. That means a damage to a brain which is not progressing. Then we will call it as a cerebral palsy or static encephalopathy. For example, suppose what are the reasons for cerebral palsy, or in general, suppose I want to diagnose a cerebral epilepsy, whether my child is having cerebral epilepsy or not, what things I need to look, whether my child development, especially the first 1 to 2 year of the life, first 5 years of the life, if it's getting delayed, in short, like gross motor area, that is the neck holding, usually should come by 2.5 months to 3 months. Child should sit with support by 6 months, sit without support by 7 to 8 months, should stand with support by 9 months, should walk with support by 10 months or 11 months or 12 months. So if this process is getting delayed, like by 6 months your child is not able to hold the neck, by 9 months your child is not able to sit, by 12 months your child is unable to stand, by 16 months your child is unable to walk without support, that means definitely there is a component we need to worry. So cerebral palsy, in short, is a static encephalopathy. It is a non-progressive disorder which is caused due to the damage to the brain. So now moving towards what are the causes, or what are the signs I need to look into my child. As I said initially, there is delayed neck holding, delayed sitting, unable to walk on a proper age, unable to run. Second thing, there is no eye-to-eye contact, which should come by 3 months. A child is unable to recognize a parent by 6 months. Child is not responding to a color object. You should suspect that do my child is having any problem in the development. Third thing, child is unable to respond to the sound, unable to respond to a visual stimuli. Again, we need to cautious that after getting loud sound also my child is not responding, which normal should respond. Then you should have some doubt in your mind that, oh, my child is having any delayed development in the hearing. In such way, your child is unable to hold any object in your hand by 6 months, by 9 months. That means again it's normal. Any abnormal stiffening or the posturing of the child during development, that also can be one of the sign for the cerebral palsy, which mother should be able to recognize in a proper fashion. Or you have to compare your neighbor's child or your brother's child development or your first child development with your second child development, and it's getting delayed. You need to consult a pediatric neurologist to diagnose whether your child is having cerebral palsy or static encephalopathy is there or not. Now, what are the commonest reasons? Previously, they used to think that baby did not cry. That is the major reason. That is the hypoxic damage to a brain. That is the commonest reason they used to say. But with the study, now it's very much proven that only 10% of the cerebral palsy is getting caused by the hypoxia, or child did not cry at the birth, or any problem with the breathing difficulty. Then it causes the cerebral palsy. That is one of the cause. But what are the other reasons? Suppose mother during pregnancy is high BP, or any deficiency of the micronutrient, any deficiency of particular amino acid may lead to a cerebral palsy, or any infection during pregnancy, like torch group of infection, in short that is the short form, What is mean by TORCH? That is the toxoplasma, then rubella, then cytomegalovirus, H for HSV, like herpes zoster virus infection. So if any infection during pregnancy, that may also create to a cerebral palsy. Any metabolic or genetic disorder may lead to a cerebral palsy. Any migrational defect, means while forming a brain in the mother's womb, if there is any problem happens, neuromigrational defect, that also leads to a cerebral palsy. So in short, causes of the cerebral palsy is hypoxia, that is baby did not cry immediately after birth, that leads to a hypoxic damage, or hypoxic ischemic encephalopathy. If child is having low sugar during initial days, that also creates a cerebral palsy. Then metabolic reasons, genetic reasons, migrational defects, syndromes, so many causes are there. Sometimes biotin deficiency also may lead to a delayed development. So these are the in short causes. Now what needs to be done to diagnose cerebral palsy? First, you have to consult a pediatrician and pediatric neurologist. Do my child is delayed in all 4 areas of the brain development? So a proper pediatric neurologist will be able to tell you what is the developmental question of your baby. So as we have seen, TORCH group of infection, what is mean by TORCH? That is the toxoplasma infection, others like syphilis, HIV, R is for rubella, C for cytomegalovirus, H for herpes virus. Now after knowing the etiology of the cerebral palsy, we will move towards what are the type of cerebral palsies are present. Depending upon generally which part of the body is involved, how many limbs are involved, it is classified. Generally quadriplegic CP means all 4 limbs involved, we will call it as a quadri, means 4 limbs. Hemiplegic CP, only one side of the body is involved, that is right upper limb, lower limb, we will call it as a right hemiplegic cerebral palsy. If it's left, we will call it as a left hemiplegic cerebral palsy. Now diplegic cerebral palsy means only lower limb is involved, we will call it as a diplegic cerebral palsy. If only one part of the body, that is limb, is involved, like right upper limb, we will call it as a monoplegic cerebral palsy. Now depending upon the other classification is depending upon the tone, that is if the child is having very low tone, we will call it as a hypotonic cerebral palsy. If child is having more tone, we will call it as a spastic cerebral palsy. If child is having fluctuating tone and dystonia, we will call it as a dystonic cerebral palsy. One more type of cerebral palsy which may be caused by the neonatal jaundice or connectors, that is the chorioathetoid cerebral palsy, because child is having continuous movement of the body. So we will call it as a chorioathetoid cerebral palsy. So these are the type of cerebral palsy. Now what are the investigation required for the diagnosis of cerebral palsy? Investigations are again CT scan of the brain, especially in a situation like TORCH group of infection, to know the calcification in the brain. CT scan is very important. But rest of the causes or the diagnosis of the CP, or to know the etiology of the CP, what we need is the MRI brain. It will show us whether there is a hypoxic damage to the brain, whether there is a hypoglycemic, that is low sugar damage to the brain, or any tumor is it's not tumor, but any hypoxic damage, hypoglycemic damage, any migrational defect, any metabolic disorder, we will be able to diagnose it on a MRI. Now few of the tests like genetic test, karyotyping is required in a syndromic child to know the underlying cause of the cerebral palsy. So in short, these are the investigation. Now what is the treatment for such kids? There are so many misconceptions. Few of the doctors also who are practicing, medical faculties, I would not say doctor, but a medical faculty, unaware that there are so many recent advances in the cerebral palsy. There is the medical management, then rehabilitation management, and then the injection like Botox injection, and then the surgical management. Basically, treatment of cerebral palsy is a teamwork of a pediatrician, pediatric neurologist, then physiotherapist, early interventionist, speech therapist, visual stimulation therapist, dietitian or nutritionist, and social worker. So it's a combined team effort, and obviously it cannot be completed by parents' support. So let us go through one by one. What is the medical management of the cerebral palsy? In that, one of the thing is the nutritional supplement like 3-DHA, biotin, micronutrient supplement. Usually they have the deficiency, calcium and vitamin D supplement. Now proper medical management, like child is having cerebral palsy which is a spastic. So to decrease the tone we have to use the medicine like baclofen, which reduces the central tone and helps in the physiotherapy. What are the other medication? Anticholinergic like trihexyphenidyl, it will decrease the dystonia as well as drooling in a child with spastic dystonic cerebral palsy. What are the other medications like tetrabenazine, trihexyphenidyl, glycopyrrolate, then clonazepam sometimes to decrease then sometimes diazepam to decrease the tone. So these are the few medications. Now if child is not responding to medication, then in tendon Achilles or the hamstring contracture we have to give the Botox before going to a surgical treatment. Third is the surgical treatment like contracture release or tendon transfer surgeries. But the most and important part is the rehabilitation team. You should have a complete rehabilitation team like early interventionist, physiotherapist, speech therapist, visual stimulation. So this is a very important part of the treatment of the cerebral palsy, that is the rehabilitation scene. If you have all services under one roof, that is the pediatrician, pediatric neurologist, physiotherapist, early interventionist, rehabilitation psychologist, then visual stimulation therapist, audiologist and speech therapist. So your result will be very good. Now one of the point I want to highlight, that is the early intervention. Early itself is will tell you that if you start the intervention program right from a birth, like a child is having preterm, did not cry after the birth, or child with hypoxia, if you start monitoring that child with the visual assessment, your BERA assessment for the auditory stimulation and neurodevelopmental assessment, and your neurologist find that child is delayed, right from the beginning you can start the early intervention. That will help the child to recover from the hypoxic damage. And most important period is the initial 2 years, very important, a very golden period where there will be a neuroplasticity to your brain, where your treatment works, medication as well as your early intervention, and that child can lead almost a normal life if child receive a good support from a team member. So at the end, just I want to aware all medical like all parents where like their child is having cerebral palsy. First and important job of the parents and medical faculty is to that cerebral palsy can get treated if treated very early. That is the golden period, initial 2 years of the brain development. There will be lot of more neuroplasticity to the brain. It gives a tremendous good result. So your treatment should start from the beginning, especially in a child with preterm, child is having an NICU stay, child is having jaundice, child is having hypoglycemia, right should be seen by a pediatric neurologist, rehabilitation team, neurodevelopmental follow-up team. So your result of that baby will be good. If you lose the important period of the brain growth, that is 2 to 5 years of the age, 0 to 2 years, 2 to 5 years, almost all that child will be having the spastic quadriplegic CP. He will be bedridden like throughout the life. So you have to help to treat your own child as well as make awareness in a community that you have to start treatment of the cerebral palsy or developmental delay right immediately after birth if you suspect, or initial 2 years of the age of the child. So result will be very good. Thank you.
Like and subscribe Eagle Health and Beauty.